Hello, ladies and gentlemen. Thank you very much for joining me today in this valuable webinar on helping you to improve this very important tissue in your body. And Ayurveda focuses on a tissue. Of course, we have different tissues in our body. We know about this. We have kind of our lymph tissue. We could call blood a type of tissue. We have fat tissue. Of course, everybody's all worried about fat, not too much fat. And then there's a muscle tissue. Everybody wants a lot of muscle tissue and not too much fat tissue. But then after that, we would have bones, and we have nerves and reproductive tissue. And that's the way Ayurveda looks at it, different types of tissue that are forming our human body. And there's different energies, of course, the energetics of Vata-Pitta-Kapha that are managing these tissue. So today we're going to talk about this we call Ashti Datsu, or in Ayurveda or Sanskrit, and that is our bone tissue. And bones, of course, we know are very important to support the entire body, our structural system, and supporting our muscles. And without them, like all other tissues, we would have problems. And Ayurveda looks at all tissue from the point of view of balance. So just like you don't want too much fat, you don't want too little fat. Well, it's the same for bones. You don't want too much bone, and you'd have bone spurs and even excess teeth growing and other conditions if you're having this type of excess bone tissue. But of course, more common is the lack of bone tissue, degenerative bone, which results in degenerative bone conditions, fractures, and even degenerative or arthritic conditions. So that's where most people are. But you can also have, of course, inflammation of the bones. It's this type of inflammatory arthritis. So we're going to try to cover these different imbalances. Then we're going to talk about different herbs that are used, both Western herbs and Indian herbs, which most people haven't heard of, but are very valuable in this type of treatment. And also maybe we'll throw in some guidelines for foods and eating as well, even though it's not really main content of this webinar. I've given other webinars on foods to build bones and to make your bones and nails stronger. And people have already asked me why we're including nails and hair. Well, according to Ayurveda, and I believe it's accurate, these are byproducts of our bone tissue. So it's still classified in Ayurveda as the same tissue. So what we call teeth is like called a superior byproduct. It's very similar. So if I want to see your bones, or you want to see my bones, it's the teeth. You look at the teeth, and then the teeth are made of the same material that our bones are made of. So it's an easy way to evaluate our condition of our bones is by our teeth, because it's a byproduct. And then there's a kind of like a waste, or we call in Ayurveda calls not a superior byproduct, but an inferior byproduct of our bone tissue. So it's the same tissue, the same ingredients, the same, we could say, molecular structure, if we want to look at it from that point of view, as our bones. That's the hair and the fingernails. But it's inferior. It's kind of almost like the waste product. It's not truly bone tissue, but it's like inferior bone tissue. So, but we can still get a lot of information about the condition of our bones from our fingernails and our hair. So it's really one subject in Ayurveda. It's all bunched together. So now so that's the overview. And so let's talk about these three different categories. So you can now assess your bones. So this is like, we've given talks on your nervous system, your liver, your blood, and these different areas. And of course, when I do these talks on fat tissue, I get the highest turnout. Everybody doesn't want to have too much fat. But we're not thinking about our bones. Of course, in people who have degenerative bone conditions, probably often don't even notice until they actually have their fracture. There's not a lot of symptoms that are known to mainstream that would indicate that you have degenerative bones until you get a fracture. So it's good to look at these Ayurvedic way of diagnosing this tissue, this bone mass in our body, and to be able to determine the quality of your own bones. And this is a proper form of a diagnosis, is to look at all the different tissues and different systems in the body. Well, the Ayurvedic way to diagnose the body is, very old, ancient system, thousands of years old. So they didn't have telescopes, even though they did practice surgery. So, but they learned to read the body, learn to interpret the signs in the body. So it's very valuable in helping you to foresee future health problems in any system or tissue in the body. And in this case, we can help you to evaluate the state of your own bones. Right now, you don't have to go do a bone density test. You can come to the conclusion yourself. Many times a patient sitting in front of me and I say, oh, your bones are very weak, very fragile, very brittle. And they go, well, I just did a bone density test, and that's exactly what the doctor said. So we can come to this understanding yourself. But it's not just a matter of I have low bone density, but it's stepping back and looking at it from kind of the Ayurvedic perspective, because there can be three imbalances. It's a tridoshic system. Vata balance, Vata is always depleted. So if you have a Vata means air and it's light. So if you have too much Vata in your bones, then you have a lot of air pockets and weak bones. It's depleted when there's so that's the first category, the Vata imbalance in the bone tissue. So this is the most common. It's a depleted state. It's a lack of bone tissue. There's a lot more. There's too much air, so this creates fragility. And you would know this by, of course, looking at the easiest way is even the teeth. If you have a lot of pitting in the teeth, holes in the teeth, cracking in the teeth, a lot of cavities, particularly in the sides of the teeth, where you get like pitting, this can be a clear sign. And of course, the easiest is really the fingernails. Fingernails should be hard and firm and not bend easy. So you can evaluate your own fingernails now, of course, if you don't have it covered in fingernail polish and fingernail hardener. But if you're using fingernail hardener, then maybe that's your answer right there. Your fingernails are not hard enough. In fact, I've worked with people and I work to strengthen their bones. And one of the comments they always said was, yeah, the bone density test got better after I followed your diet, took your herbs. But what really they noticed was their fingernails became hard. Like musicians who played guitars, for example, have told me that they always had to put fingernail hardener on their whole life to be able to play classical guitar with their fingers. But after working with me for some time, their fingernails became much harder and they no longer needed the fingernail hardener. So this, what we want to do is evaluate your fingernails. First, you want to look at how firm it is. If it's soft, well, soft bones. If it's brittle and you're getting splitting, this is brittle bones. So it is a slight difference, but they're both in a depleted state. That's the main point. They're lacking of. And I want to make it clear, we're not going to talk about nutrition today because, I mean, this is I would say, a limited type of understanding of how to strengthen your bones. Take more magnesium, calcium, get more vitamin D, trace minerals, etc. These are the ingredients, so to speak, to build bones. But, most of the time we're taking these synthetic substances like magnesium citrate, calcium carbonate, and D3, which, all are made in a laboratory. They're not growing on trees. They're not organic items, foods per se. So, the effectiveness is debatable. And there's some forms like I did some reading on D3, for example, and it said it had a D2, and that it didn't absorb well into the bones and didn't help build bones, and that's why they moved on to D3. So sometimes these synthetic substances don't do the full job. Like people were taking D2 and their vitamin D levels were good, but the bones weren't getting stronger. That's the research that I read on why they phased, one of the reasons they phased out D2. Apparently D4 has already been invented. So these are synthetic substances that are trying to mimic the needs of the body to build certain tissue. But in Ayurveda, they don't approach it this way. They just they approach it directly, like what foods, what herbs, what lifestyle habits are going to get the results that we want, which is building bones or reducing down the bones or reducing down inflammation in the bones. So it's just a direct approach. It's like you don't have to understand the nutritional content. And I think this is a more holistic and definitely natural approach, because you're eating foods that you know that will build the bones. And all these herbs are ground up foods that are known to help build the bones. And if you were to test them, of course, many of them would be very high in calcium, magnesium, and a full range of trace minerals, and many phytonutrients, which we don't even understand yet. So when you take a synthetic isolated supplement like calcium citrate or magnesium sulfate, this is an isolated mineral from the periodic table that's been made in a laboratory. And sure, your bones need this, as many tissues in the body need these minerals. It's not only the bones that need these, but it's not the complete ingredients necessary. It's like incomplete. And that's why results are not as good as taking herbs, for example, that have the full spectrum of nutrients. So I just wanted to explain that, because I know some people are asking when I do these talks on some of these subjects, particularly like bone, they're asking about what's good for vitamin D, what is high in magnesium. But you have to be very careful just saying, well, my bones are weak, I'm going to eat a lot of foods in magnesium, because that's can get you in a lot of trouble. For example, people say, well, cacao has a lot of magnesium, so I'm going to eat chocolate every day. And okay, say you want to be a good chocolate eater and you just have cacao all by itself with no sugar, because it has a lot of magnesium. But there's having a lot of cacao has adverse side effects, and actually it's very inflammatory. So most arthritic inflammatory conditions, particularly where there's heat and inflammation on the joints or the muscles, we always remove cacao or chocolate from the diet, because it's got this inflammatory nature, despite the fact that it does have a lot of magnesium. So this could go for eating any type of food based on you just trying to get one nutrient. I see this mistake done every day, where people are eating, well, they want a lot of potassium, so they're just going to eat a lot of bananas. And now they're wondering why, they're overweight and, their blood sugar has gone through the roof, because, they're eating bananas all day long, trying to get potassium. I see people having tomato sauce all day long and eating a lot of tomatoes because it's high in antioxidants and vitamin C, and they think it's going to help them. But in fact, tomatoes, as we know, are from the nightshade family and very inflammatory. So you may think, well, there's a lot of vitamin C and antioxidants in tomatoes, and that's what it will say online. So by eating tomatoes, this should help with my inflammation. But in fact, it makes it worse. So we see this, of course, even with dairy, where people are avoiding dairy for digestive reasons. They can't digest dairy. They can't. And it's important to understand that I believe the human body is capable of digesting piece of cheese. Yeah, I do believe so. Whether you eat it or not, I believe the human body, and my experience and helping maybe thousands of people and over the years, is well capable. And my understanding of anatomy and my understanding of the ancient sciences of Ayurveda and Chinese medicine, that in the digestive system in particular, which is one of my strengths in practice, the human body's definitely able to digest dairy, and it's able to digest wheat, bread. So if you can't eat a piece of bread, you can blame the bread. And I know most people do. They blame the bread, and then they break it down and they blame the gluten. The gluten is the problem. And dairy too, people blame the poor dairy, blame the cow. The cow's taking all the rap for this. When for thousands of years, people have been having cow milk, goat milk, and they've had no problems. But today, suddenly, nobody can eat it. I know we're a little off subject, but we're on subject because dairy is one of the foods that is most effective in, guess what? Building bones. And ask your grandma if you're not sure about that, because if your grandma, she was still maybe connected with the ancient knowledge that was passed down for thousands of years. And they always knew that dairy strengthened your bones. They did, and Ayurveda backs this up as well. So, if you can't eat dairy and you're getting digestive problems, don't just blame the dairy. You need to fix your digestive system so you're able to have dairy. I'm not saying dairy is good for you or everybody. Some people, we have to reduce it. Some people, they need to increase it. But I have seen a lot of vegans here. I live in Ojai, California. Maybe, I don't know if it's the home of the vegan, but we got a lot here. We're definitely producing a lot of fad diets here in this part of the world, in Southern California and up in the mountains in Ojai. We got a lot of diets coming out of this area, and many of them don't advocate dairy, and many of them are not advocating wheat anymore. We have a lot of crazy diets: no carbs, no dairy, no wheat, no gluten. Everybody likes to eliminate everything. So somebody passed the question: what about goat or cow dairy? Well, that's true. There's a big difference between the two. Well, goat milk, for example, is a little heating and warming. Well, cow milk is very cooling. And that's one of the big differences. And of course, the source is very important. I've always said that, the problem's not the cow and the cow milk per se. It's really what we've done to it. The homogenization, the pasteurization, and taking out all the fat and putting it down to 1% fat or low fat milk with pasteurization and homogenization. At that point, you probably, and of course, these are not grass-fed happy cows, as we know. So at that point, that type of dairy that we're getting in a supermarket, I would say, is poisonous to the body, and 1% milk is not going to help build your bones. So when I talk about dairy, I'm talking about fresh, raw, organic milk and cheese, both goat and dairy. And when I was traveling overseas, we had some camel milk, and very tasty, very, very nutritious. And I asked this, I was out in the Emirates, and I said, why do you drink camel milk? And the Bedouin basically said, makes bones stronger. So here's a guy living out in the desert raising camels, and he knows very well that drinking camel milk makes his bones stronger. So if you have a difficulty to digest dairy, and not all dairy is the same too. I mean, cow milk is more difficult to digest than goat milk. Cold milk is much more difficult to digest than warm milk. So you often have to make it warmer. Some people said they could never have milk, and I told them, go back, take some raw goat milk from the health food store, warm it up, have it with a little cinnamon, cardamom, and drink it. Tell me if you have any problems. And most people said no problems. Once it was warm, once they had goat instead of cow, which is easier to digest, they had no troubles. So we tend to throw the baby out with the bathwater. We generalize too much. And people say, I can't have dairy. And I said, so if I give you this piece of butter, you can't eat it? And they go, oh, no, I can have butter. So, well, that's dairy. So it's it's very simplistic to say, oh, I just can't have any dairy. Because maybe you're just having trouble digesting cold milk or having processed, homogenized dairy products, and now your body's created a adverse reaction to it because it's somewhat hard to digest homogenized dairy, and the body can even create an immune reaction to it, and then you can have an allergic reaction to it. So you have to have a good source. Yeah, better to have your own cow, your own goat. So let's go back to the subject and talk about the 3 types of imbalances to our bone tissue. And the first we talked about was this vata state in Ayurveda. It's a degenerative state where the nails are soft, the nails are brittle, the teeth are maybe having little cracking, and we can assume the bones are weak. And even there can be the hair falling out or lack of growth. But the second category is an inflammatory condition. We know the bones could not just be depleted, and you could end up eventually with a degenerative arthritic pain. But there's another type of arthritic pain. It's more of an inflammatory arthritic pain. And this is where the bones feel like they're inflamed. They're warm. You touch them and they're feeling hot. They're heating up, so to speak. That's the inflammation, that burning. And this is a different type of arthritic pain. It's an inflammatory bone pain. And this, we often see more hair loss, abscess, nail infections in the toes, tooth abscess. When the bone's inflamed, then you get an abscess. It's coming out through the gums, and this is like an inflammatory bone condition. So oftentimes people with this type of inflammatory bone condition have the toe fungus and inflammation in their gums. So usually when you're have inflammation, it's not just only in one part of the body. It may be the worst in your bones, but it could be in your muscles. Your muscles could be tender and soft. Your gums could be inflamed as well. Your gums are made of muscle tissue. We didn't do a talk on a muscle tissue, but muscle tissue is what's holding the bones or your teeth there. That's your muscle, holding the teeth in place. So you can often look along the gum line and look for like red, inflamed, and we see that gums are inflamed. And you can see along the fingernail too, if you see a lot of red and inflammation in the cuticle, then this is a type of inflammation in your tissue. And the muscle tissue and the bone tissue are, they're close to each other. Even in Ayurvedic terms, they're supporting each other. Excuse me. So often when we have an inflammatory bone condition, we have inflammatory muscle condition as well. And we can see this inflammation in the fingernail cuticles. We can see it in the gums. So, and it can be a lot of hair loss because the bones are inflamed. And remember, the hair and the nails are the byproduct of the bone. So when they're inflamed, they're not generating well. They're being damaged. Whenever there's inflammation, it's like damage taking place, like fire. I mean, if it's a little fire in your house, then that section of the house is going to be damaged. So if you have inflammation in your muscles are being damaged. Well, that's why you get the pain. The pain is telling you we got some damage going on here. You need to pay attention. And we have inflammation in your joints. It's damaging your tissues. So it's very serious. So the third category, we have depleted bones, and we have inflamed bones, and then which is a pitta condition. And then we have a kapha, where you have excess bones. And this is less common, but you see it. Big, heavyweight people who have a lot of body mass, a lot of maybe body fat, body muscle, and big bones. They can get bone spurs, and even excess hair growth. Growing too much hair on the chest, the back, and having wisdom teeth growing in too soon, too big, extra teeth growing into the body, and also hypothyroid is in this category. It's a little more complex, but it's the thyroid gland has a lot to do with the bone tissue. Let's go back to what I think most of you are concerned about, and this is a degenerative bone condition. And let's talk about what we could do. I mean, real quick, we'll cover a little food, and we did cover dairy, and that's why I did bring up about it first. When I see vegans or those who haven't had dairy for an extended period of time, I check their fingernails. And sometimes I can even guess that they're not having dairy by just feeling the fingernails, soft, brittle fingernails. And some you can pull on their hair a little bit and see if it's coming out easy. Look at the teeth, see if there's pitting around the teeth. And of course, you can look for inflammation as well in the same manner. And feel inflammation because you can feel the heat. So that's the best way to diagnose whether you have a degenerative bones by your fingernails, your hair, your teeth. Other signs of a degenerative bone would be cracking. I got crack here, but that's when they're cracking easy. A lot of times it's lack of fat in the body. So the same person that has a low body fat will often have weak bones because the bones require this fat to build. It's one of the ingredients. So if you're underweight and you're thin, skinny with ribs and bones sticking out, your bones are not getting the nutrients they need. So we see people who are very thin. There's a lot of social pressure apparently for women to stay ultra thin, even unhealthy thin. And then they're also maybe doing vegan diet, and that's one reason they're staying thin by avoiding these building foods, which the most building foods you can have meat, dairy products, and even wheat and grains, the things that people are avoiding. Which, of course, if you're overweight, you're obese, and you have bone spurs, then you don't need any more dairy, and more than likely a vegetarian diet would be suitable as well. But if you're thin, underweight, then most people in that condition can benefit by putting on more weight, having more fat in the body to support the other tissue, because the other tissue, particularly the nerves and the bones, are reliant on the fat tissue. So when it's another point, we're kind of a little off on another subject, but it's related, that if you don't support the tissues that support your bones, like fat tissue, then you can deplete yourself as well and make your bones weaker. So the main foods that build the bones are, like I said, these animal protein, and then also nuts, and particularly sesame seeds. A home remedy is to chew 1 teaspoon of sesame seeds every day. And a lot of times I have people do tahini. So we're not going to talk too much more about the food, because it's another subject. But let's talk about some herbs that support bone growth. Let's talk about little Western herbs first that are easy to understand. What do horses live off of?
Alfalfa.
That's right. There we got the alfalfa. Yeah. So I could have brought some alfalfa from the trunk of my car from moving it around, but there we go. Alfalfa, very nutritious, a wide spectrum of nutrients in alfalfa, and often used in building and strengthening the body. And another one that's very nutritious. These are just like highly nutritious herbs, Western herbs. Another one is, which growing out in the back, which is stingy when you touch it. It's growing. Nettle, that's right. You guys are slow online. Nettle. So nettle also one of the most nutritious of all herbs. And then one of the best for bones and hair is actually horsetail. And you can go look at the nutritional breakdown of these. Nutritional breakdown of nettle is phenomenal. I mean, and alfalfa too. You can see why. There's animals that can live off of these. And I have a tea called vitamin mineral tea. And we can go through some of these. Now, this is supposed to not just build bones. This is good for children and elderly. But the first ingredient is alfalfa. And we put some peppermint because alfalfa and nettle just doesn't taste very good. They're very bland. They're very nutritious, but they're not tasty. So we put in some peppermint. Then the next ingredient is nettle. And then the next ingredient is horsetail. And then we put in hibiscus, of course, for, I don't want to say vitamin C, but okay, I said it. And then we put in a lemon peel. Again, I don't want to say vitamin C and phytonutrients, but I said it for simplicity's sake. And then cinnamon, just to make it taste good. And coriander, again, just to help to make it taste pleasant. And stevia, to make it sweet, to make sure your kids drink it. So this is a tea, which I give people, children, elderly, those who are weak, and it will slowly help build bones as well. In fact, I tell a lot of people, why are you drinking water all day? You're weak, you're frail, you're underweight. Why are you having the water? I mean, the water's not giving you much nutrients. Particularly our water nowadays is been processed and, reversed osmosis, distilled. So, I mean, where's the minerals? Gone. So when you have a tea like this, you're putting minerals and vitamins back into your water. And particularly for elderly people and young children, this can be very beneficial just to be drinking the tea all day long, because you don't have to digest it. You're really just drinking your vitamins. And many people have told me that they just drank this tea all day long, this vitamin mineral tea, and their energy got better, their nutritional blood work became better, and they overall health improved just by drinking that vitamin mineral tea all day. That's where I went to their home and I saw their elderly mother in bed or something, and I told them, stop giving them water every day. Give her this nutritional tea. I mean, you can make it yourself. I gave you the ingredients, and you could give this to your mother every day. And this is be much more beneficial for somebody who's weak, frail, than just giving them water, which, water is cleansing. But like I said, and it does have minerals in it that are helpful, but nothing compared to a cup of this tea. I used to sell herbs in the farmer's market here in Ojai, so people would come by and buy these teas. And sometimes people said, well, I heard you're an herbalist and I don't know what tea to get. So what would you recommend? Well, I didn't know the health. I said, I have sleeping tea, relaxing tea, weight loss tea. And if that didn't work for them, I just gave them the vitamin mineral tea because everybody could drink it. And that way I actually got a lot of feedback of people who told me that it really helped them a lot. And people who said their grandparents were bedridden and they drank that tea for 3 days and they were out of bed. People who say their hair stopped falling out, their energy got better, all from drinking that tea instead of water. So very, very effective. And now we can talk about, and you could take those herbs also in a powder form too. I have like a superfood here. It's not necessarily for the bones, but it is a vata one, so you're depleted. And I put in a wheatgrass, spirulina, chlorella, beetroot powder, and these. And then, of course, there's a little cumin, cinnamon, ginger to help, and some kelp, because kelp has a trace mineral. So this is very building, very strengthening. So say you're a weak, underweight person, you could be drinking the vitamin mineral tea all day instead of water. You could take a couple scoops of this, and will cover all of your vitamins and minerals. Maybe you could supplement with some flax oil and some other healthy fats. But having more dairy in the diet, cheese, particularly if you love it, particularly if you're underweight, particularly if you can digest it very well, then you should have it. You shouldn't listen to what other people say. Maybe it's not suitable for everybody. If you're a heavy, overweight, obese person with respiratory problems and congestion, obviously you can't be having dairy. But if you're not in that category and you're concerned about your bones, I would increase the dairy, particularly soft cheeses, butter, and warm milk, goat milk if your body temperature is cold. If you tend to be a hot person with a warmer body temperature, then you can have more cow milk. And then have these natural supplements, which I just talked about, chlorella, barley grass, wheat grass. There's a vast amount of them, and they're all very nutritional. And another one is kind of used mostly in Indian culture, but I think people are aware of it here, and it really very good at strengthening the bones. I don't know if anybody can guess what it is. It's like a kind of a white powder. It's a little pinkish, but it's kind of white. Any guesses here?
Himalayan salt?
Not Himalayan salt. It's good. I mean, Himalayan salt or mountain salt, we call it, because there's also sea salt. There's mountain salt, and then there's the processed poisonous stuff that's, on the table in the restaurant. Iodized salt, right. This is a limited, no trace minerals in it all, just one, so this is how salt got a bad name, because again, it wasn't the mountain that made the bad salt. It was humans ruined it, just like, cow isn't making bad milk. We're ruining the milk. And then we think that it's all bad. But again, with salt, you really need all these trace minerals. So salts have, depending on the type of salt, sea salt to like black mountain salt and pink Himalayan salt in the middle, have anywhere from 70 to 80 trace minerals. And these are very important for building bones. But this is a powder, and it comes from the ocean. Any more guesses?
Kelp.
Kelp. Oh, kelp's another good source of minerals. And you can see I put it in this superfood, and this is a Vata superfood. So this would be for somebody who's, underweight, thin, and possibly depleted bones. Hey, somebody got it online. That's right. Coral. That's right. In Ayurveda, we call it pravopishti, but it's basically kind of treated coral. They cook it and dry it and cook it and dry it multiple times so it can be digested easy. So it's not pure coral, just ground up coral. They actually treat it in big vats by boiling it, and even they have certain herbs and things that they cook it with, and then they dry it out again, and they do that multiple times so it's absorbable. But if you look at the nutritional breakdown of coral, I mean, it's very, very high in calcium. It's all basically, you could say it's a natural calcium supplement. But again, it's not, just made in a factory. So it's not just calcium citrate, or it's got magnesium, trace minerals, and the broad spectrum of nutrients, and very, very effective building bones. The only reason I don't put it in here because it's kind of pricey, coral. So I provide it separately. But while we're on the subject of trace minerals, which are an important ingredient, because see, what we're trying to do is give the body the ingredients it needs to build stronger bones. In this case of depleted bones, we're going to go talk a little bit more about inflamed bones here. But now we're talking about building bones, growing hair, making your nails stronger. They're all going to happen together at the same time. And we need these trace minerals, the sea salt. But another good source of trace minerals, in fact, in Ayurveda, we could call it the trace mineral supplement. It's dark. It's also not a plant. It's hard to kind of tell. But it's called shilajit. I think this is an extract, shilajit extract. And this is a mountain, it's a mineral sap, is the English translation. It oozes out of the Himalayan mountains in the summer when it's hot. And basically, it's billions of years of crushed trees that are become liquefied. Not quite oil, but it doesn't have. It only happens in certain parts of the world. But it oozes out of the mountains. It's like black, like a tar. It's very similar to like asphalt. But this is somebody's asking for the spelling there. There it is, Shilagit, Shilagit. Yeah, and you go read about it. It's called what makes you strong, and you only need a pinch, because it's like a multi mineral supplement. All the minerals, and you can go research this. Of course, if you love nutrition and you really need some scientific proof, then you can go look at Google the nutritional content of shilajit, nutritional content of coral, and you can be quite impressed. And then there's another herb, which I'm going to show you a picture of now, and this is called hadjod. And hadjod, I learned about this herb in India. It's not a common herb here. and even Ayurvedic herbalist isn't used a lot. So, and take a look at it here real quick. I'm going to share my screen. This is hadjod. See the name? Hadjod. And look at the shape of it. See, that's it right there. It's got these little leaves, but they use the stems. And the stems are kind of like bones. See, it's like your elbow bone there. See and then it's all connective, like it's almost like little joints in between it. So this is hadjod. And the Ayurvedic name is using the word bone building in it. And I have a pound of it here from India. And I only use it for building bones and for strengthening bones. And of course, I sometimes peek and look at the nutritional breakdown of these herbs too, particularly when we're talking about building a tissue. And it's very high, of course, in calcium, magnesium, trace minerals. And it is a living plant. So now I've pretty much told you the main ingredients. Oh, one more ingredient, which we use in Ayurveda. It's called dashamula. And I mentioned it. And dashamula means 10 root herbs. So it's not one herb in here. There's 10. It's a very common Indian formula called dashamula. And it's a formula. DASHMOOL. Dashamul. You can put an A on. Dashamula. And it means 10 herbs. And they're high in nutrients. We give it for, they're anti-inflammatory as well. But we use it for building bones, building tissue, building muscle. It's a building. So most of these are building, just like dairy, wheat, dashamula. They're all going to build, make you bigger, stronger, the bones stronger. And this dashamula formula is used in a lot of degenerative conditions where there's lack of nutrients, there's lack of weak muscles, inflamed muscles, degenerative bone conditions. It's often even mixed with analgesic, pain-relieving herbs in degenerative arthritis, because you not only have to bring down the inflammation, you got to build the bones, and you got to provide the nutrients. So now I've given you the main ingredients here for an Ayurvedic formula called Ayurvedic bone building formula, which I learned from an Indian, the famous and dear friend of mine, Dr. Vikram Chauhan in India. He was the one who taught me about hadjod. And so the ingredients are purified coral, which I showed you. And then that's the main ingredient. So this is like half. Second one, hadjod, which is the premier bone building herb that in Ayurveda, as far as I can see, is my knowledge, is only used for building bones. I haven't used it in any other phase. And then there is Arjuna in here, which is another herb, is also a building, and Bala. I didn't talk about that. Bala Bala means strength, so this is also another building, strengthening herb. And then dashamula, which is 10 herbs. So it says dashamula here, but there's actually 10 herbs in it. And then the last one, which people have started to hear about, amazingly, is moringa. There's a little moringa in here. Moringa is also very nutritious. So this is you could call this a calcium, magnesium supplement, but particularly it's going to help build the bones. So if somebody comes to me with a degenerative bone condition, I can give them this, take 2-3 times a day, drink the tea all day long, get them back off the vegan diet, back into some dairy a little bit, and let them do that for a month. They'll come back in a month. They'll probably gain some weight, eating the dairy, eating more food, stop skipping meals, and bones will get stronger, nails will get stronger, and hair will stop falling out. So we didn't really have to talk about nutrition. And most of my clients are just getting rid of all the supplements. And particularly if the person was weak and frail and are maybe done a lot of cleansing or detoxing. You know, people love to do detoxing somewhat to an extreme. So they're depleted. And if you do too much cleansing, too much detoxing, too much fasting, too much skipping meals, too much juicing, too long of without any type of animal protein, I'm not saying it's good for everybody, then you can deplete yourself. And to those type of people, I would give them the Vata superfood first. So that's my basic treatment, is do a Vata balancing diet, which has dairy, a lot of root vegetables, give them the superfood to get all the nutrients, get rid of all their supplements, give them the bone building formula twice a day, drink the tea all day long, and it works like a champ. 30, 40 days, people are coming back. People are going and doing bone density tests and telling me, oh, yeah, the doctor said my bone density has improved immensely. And they stopped all supplements, no vitamin D. Of course, if they're not getting, I tell them you need to be outside, you need to be walking, you need sun, you need to keep active. You can't sit on your butt to grow your bones. So the bones need to have some activity. So, if you're not getting any outdoor light, then, maybe you could take D3. But I encourage, some outdoor activity in the sun every day as a better source, or a cod liver oil. And I think probably a safer choice, or at least a natural one, of D, because you have your E, your D, your A, all your fat soluble nutrients are in cod liver oil. Fish oil doesn't have the D. So those are the main herbs. Let's see and then you could put some shilajit in there too to further give them more minerals, but it's often not necessary. Shilajit's used for a wide range of things. So that's the main treatment protocol for building bones, strengthening nails, and growing more hair if you're depleted. And we call that category vata. In the bones are bones we call ashti, and datsu means tissue. Ashti, datsu. So that means bone tissue. Like I said, there's 7 main tissues in Ayurveda, and each one feeds the next tissue. So when you eat, it becomes what we call rasa, or like partially digested, and then it absorbs, get into a kind of our lymph and our red blood cells, then it gets into our plasma, I should say, and then it gets into our red blood cells and circulates to our body. Then it goes to our muscles, these nutrients, and then it goes, our muscles use up what they need, and then any little extra goes to our fat tissue. And then the fat tissue is feeding the bones and the nerves. So I've repeated that again. If you're low in fat, then you don't have the one of the main the sources of supporting your own bones and nervous system. And this is a beauty of Ayurveda, how they understand this. So the same person who's underweight, thin, low body fat, because in Ayurveda, you don't want too much of something, you don't want too little of things. Of course, we all know we don't want too much fat, but we don't realize that too little fat can be detrimental, because then the bones become weak and the nervous system becomes overly sensitive and can also have imbalances. And a lot of times the same person who's got the degenerative bone condition, because the bones aren't getting enough nutrients to grow strong, is also having nervous issues, maybe little neurological problems, or even some neurological conditions, because that's the way the nerves are fed. The nerves, we know, are getting a lot of their support from the bones, and particularly the bone marrow, and the bones are getting their support from the fat. So if you don't have enough fat, then these following tissue that are being built aren't able to be strong. And the last tissue, of course, is the reproductive tissue. So the person who has degenerative low body fat, degenerative bones, nervous problems, probably has fertility issues as well, because the last tissue to be able to take the nutrients, if we could use those words, would be the reproductive system, which isn't necessary to survive. So that's why it's last. So if you're not supporting yourself nutritionally, we can say, and you're depleted, then your reproductive system more than likely isn't able to have the nutrients it needs to be fertile, both for the man, lack of sperm, and the woman, infertility and weak reproductive system. And so very important to make sure that you're not depriving yourself. So let's talk a little bit about the next category here, and then I'll stop and answer some questions. That's inflammatory bone conditions. And this is when the bones are inflamed and they're painful. So it's a kind of a separate subject. I've done many webinars and talks on arthritis and inflammatory bone conditions. So, but when they're inflamed, of course, we're using completely different herbs. And we're using anti-inflammatory herbs. We're using more herbs like, a googaloo. We have different ones for different type of inflammatory conditions. But googaloo, this is Yogaraj googaloo we're using for arthritic, degenerative arthritic pain, where there's pain. But to go back to the depleted bones, the degenerative bone condition, where you get the cracking and it hurts when you're moving, this is a degenerative bone condition, and it starts, eventually it will become inflamed. So if all your bones are cracking, crack, and your fingers are cracking, and everything is cracking, well, you don't have enough fat, more than likely, or maybe on a fat-free diet or something. And now you don't have a lubrication, because fat is more than just body fat. It's protecting the cells of every cell membrane, every nerve in your whole body. The skin is covered in a type of fat, and it's lubricating all the joints. So this extreme low fat diet, then you get these cracking bones, and of course degenerative bones, and eventually that will become inflammatory. But also bones can just inflame due to systemic inflammation. This is a whole other vast subject, and most inflammation in Ayurveda, we're calling it a pitta condition, where there's heat, burning, pain, inflammation, muscle inflammation, you could call it fibromyalgia, joint inflammation, you could call it rheumatoid arthritis. But in Ayurveda, we just call it muscle inflammation and joint inflammation. And these are often due to toxins accumulating in the body. And that's why Ayurveda uses detoxification and cleansing to reduce down this inflammation. And of course, there's many anti-inflammatory herbs, far better than just turmeric or curcumin. We use boswellia. Boswellia is much more anti-inflammatory, for example, than turmeric. You'd have to take, what people told me, they were taking 5, 6, 7 tablespoons of turmeric a day to bring down their joint pain. Well, I was giving them boswellia, 1 teaspoon twice a day, and their inflammation went down. And that's a vast subject, reducing down inflammation. People don't often understand what's inflammatory and what's not inflammatory. I'm not sure what happened with the scientists in the lab, what they came up with this stuff, but they think a lot of things are inflammatory. But dairy, we can't say it. They think it's inflammatory, but butter is not inflammatory. If you have a degenerative bone condition and your bones are cracking and they're hurting, then we actually increase the butter. And if you're young and you get these cracking joints all the time, but you don't have the pain, I sometimes advise people that I don't give them any herbs for it because they don't have pain, but I just tell them to get back on the butter bandwagon here. And when they often love butter, they're just not doing it because they think it's not good for them, even though their body's craving it. And then when they do that, even for a couple weeks, then they find that they don't have the cracking anymore. And they've probably avoided having a degenerative bone condition in the future. And the best butter, somebody asked me here, is ghee. Ghee is a clarified butter where they've taken out the animal protein. It's easier to digest and lacks the animal protein, so it doesn't contribute to cholesterol. So if you're having high cholesterol numbers, it's another subject, then you could still have some ghee, but not butter. And that will help to lubricate the joints by having more oil, and particularly butter in the diet, so you don't get this inflammation. So those are the, reducing inflammation is very important. Sugar is very inflammatory. Toxins from all of the pesticides and chemicals and drugs and flu shots accumulating in the liver can make the liver tender and inflammatory and create skin problems and rashes. And then you get muscle tenderness. When the muscles are like rubber, this is the body storing toxins in your fat tissue. It's so much toxins that you accumulated from whatever you did in the past, and the body wasn't able to eliminate them, particularly if the skin is dry and you're not sweating very well, then your skin is blocked. If you're not sweating, your skin's blocked. So then the toxins aren't able to get out. They go in the fat tissue. You get this hard, rubbery fat, and eventually it becomes inflamed. So you feel the people with fibromyalgia, not only their muscles inflamed, but the fat doesn't feel soft. It feels like water, like hard. People have told me they feel like they're wearing like a wetsuit. So that's toxins toxins in your muscles, creating inflammation. And at that point, you're going to have it in the joints as well. And according to Ayurveda, in my experience, these toxins circulating through your bloodstream for years and years and years, get lodged in different points, and they get lodged in the, some people, if they're not sweating, they get in the skin and you get rashes and skin conditions. But a lot of people, they get, particularly who are dry with poor circulation and not sweating much, they get lodged in the joints. So then you get an arthritis in the joints from toxins accumulating over the years in these joints. You have to cleanse it out. So that's another vast subject. I'd encourage you to look into that, or if you have inflammatory joint condition, contact me, because the herbs work very well here. So I think we covered a lot. I got all my herbs out, Shilajit, the coral calcium. So I think that's my bone building formula. So I basically give you my protocol. Somebody's asked about olive oil. Oils are very different. Sunflower oil, flax oil, olive oil. Of course, in the West, we break these things down by, polysaturated, saturated, monosaturated. And Ayurveda doesn't use that type of nutritional view. They just use what oil is good for which person, because there's a very individualized type of approach to healthcare. There's no one oil that's good for everybody. There's no one food that's good for everybody. But you don't want to fry olive oil, and olive oil is, good for cardiovascular conditions. It tends not to congest. You have to be careful with more saturated fats, particularly heavy. We call them, in Ayurveda, just call them heavy oils from red meat. Even coconut oil is considered a heavy oil, and we take people off of it who have fatty liver, gallbladder problems, because it's too heavy of an oil. We use lighter oils like sunflower oil. Some oils are cooling, like coconut oil. Some oils are heating, like sesame oil. So this is an Ayurvedic point of view. But many people have lack of fat in their diet because they're scared. I think we need to rename fat. I think it's just got a bad name, fat. I think we have to, maybe we just call it oils. That your body needs oil, just like your car needs oil to keep going, and if you don't have it after a while, that, your car is going to start going, grinding, and you're going to damage the engine, and eventually it's going to burn up. And same thing happens with you. If you don't have enough oil, then, your mind becomes a little slower, clogged, the joints are cracking, circulation, becomes poor, and then you can also start increasing inflammation by not having enough oil. So, and somebody mentioned about oil pooling. That's on subject. Good. I'm happy to have questions on subject here. Yeah, that's a good way to build the bones. The best oil to build bones, since that's our subject, is sesame oil. And that's why we have sesame seeds or tahini to build bones. And we even put, so as a very good, thank you for bringing that up. We put a sesame oil on a person's body every day, or tell them to do it every day, and this will penetrate right through the tissue, right to the bones, and support the bones. And that's why we use sesame oil, not other oils like coconut oil. I mean, if you're in the sun and you're cooking and you want to stay cool and you don't want to burn, then coconut oil is your choice. But if you're in the winter, you don't need coconut oil, and if you're cold by nature, you don't want to use coconut oil on your body because it's a cooling oil. But sesame oil is preferred for this abhyanga or oil massage. And that's one reason they do it, because it supports the nervous system, supports the bones. So a person who's been on this low-fat diet for 20 years and their memory's going, because a big cause of dementia and cognitive problems is low fat. People on low-fat diets for 40 years, drying out their brain, drying out their bones, drying out their tissue, so to speak, on this low-fat diet. So what we do is just give them, of course, increase the fat in the diet, ghee being one of the best sources of fat, and then put sesame oil on the body every single day. And that makes a difference quite quickly. It calms down the nervous system that's been depleted with bones. We get people with like neurological problems like Parkinson's or MS. We put oil on the body, and this absorbs right through, and a nervous system really benefits quite quickly. We can see tremors and shaking subside with a matter of days of doing sesame oil massage. In fact, in India, you can even do treatments where they put you in a whole pot of oil, a big giant pot. They make you wash really good. You wash really well, and you get right in the pot. And you just soak in this oil, and it just penetrates your body. But yes, thanks for reminding me about oil pulling. So if you want to strengthen your teeth, it's the same way. You oil pull with sesame oil, not with coconut oil. If you have an infection in your mouth and you have an abscess, you have some burning, some pain, you can use coconut oil short term because, again, it's cooling, anti-inflammatory, and helpful in those type of inflammatory gum conditions. But daily, it's sesame oil. That's the proper oil to be using. And you just drink some sesame. Don't swallow it. Just put a couple of tablespoons in your mouth and just wish it around without in and out of in between your teeth. After you clean your teeth, first you clean your teeth. Then it's good to rinse your mouth with some salt or saline solution, or to kind of cleanse it out, and then put in the oil and try to leave it in there for a little while and pull it back and forth between the teeth. Usually I get dressed or undressed while I'm doing it. It takes me a few minutes, and then you spit it out, and then scrape it off your tongue, and you can rinse your mouth again with the salt water just quickly. And this will support the teeth and improve your teeth. In fact, if you're not going to a dentist at all and you want to avoid a dentist, then doing oil pulling every day is very good, because it's going to keep your bones, your teeth strong. And if you're having a lot of problem with your teeth, then you want to really pay attention to what we just talked about today. Relook at your diet, and same with your hair, because these are all examples of the same tissue being in the state of the tissue. So, and people who've had little cavities, just minor cavity, just coming on, very short, they've told me that they do oil pulling for 5 or 6 days and the pain went away. And people have told me that they've done oil pulling on cavity for a month or two and the cavity went away. So, that we know our bones are growing because we break a bone and it can mend itself. So the teeth can also mend themselves, but we can't be living on this low fat diet and think that we're just going to take vitamin supplements in a capsule and really make our teeth strong. I haven't seen that take place with people just having synthetic supplements and strengthening their teeth. It really takes, I think, these right foods, right activity, sunlight, and this oil pulling seems to work quite well. People have told me that it works. I've just been doing it for a long time and avoiding cavities. But people have told me even with cavities, they were doing this oil pulling, and the tooth healed up within a matter of month or two of doing oil pulling. So very beneficial, very beneficial. Okay, well, let me stop this, and then I'll take some questions there. But I thank you very much for joining me. For those who are watching live or the recording, please contact me if you need any help with your health or making your bones stronger or helping you, particularly with inflammation. I've helped a lot of people with inflammatory joint conditions, and herbs and the treatments work very well. So now we'll just take a few questions.